Hi everyone, my name is Rene So. I'm a student at the University of Maryland School of Pharmacy. Today we'll be talking about a particularly interesting subject, namely partial filling of controlled substance C-2. We already know that prescription for non-controlled substances can be partially filled as long as the prescriptions are valid. Similarly, prescription for controlled substances C3 to C5 can also partially be filled as long as they are valid. Now, what about C2 controlled substances? The question we can ask is, can a pharmacist partially dispense a C2 medication? Of course, a prescription for a C2 controlled substance may be partially dispensed by a pharmacist if she or he is unable to supply the full quantity of a written or emergency phone call prescription, or the patient requests only a partial fill out of the prescribed quantity. Once a prescription for a C2 has been partially filled, what a pharmacy must do after that? The first thing to do by the pharmacist is to note the quantity supply on the front of the written prescription or on a written record of the emergency phone call prescription. After that, the remaining portion may be dispensed within 72 hours of the first partial dispensing. But here there's an exception. In the case of an emergency phone call for a C2 prescription, the pharmacist cannot dispense a partial fill. For instance, if the doctor called in for 10 tablets of morphine sulfate and the pharmacist has only 5 tablets in stock, he or she will inform the prescriber that he can only fill a prescription for 5 tablets of morphine. If the remaining portion cannot be filled within the 72-hour period, the pharmacist must notify the prescribing practitioner. And finally, in the event that the patient only needs a partial fill out of the prescribed quantity, the pharmacist should still notify the prescriber about the quantity dispensed to the patient. Always make sure that this is in accordance with your state law. The information presented in this video might differ from one state to another. As a result of that, always make sure that you comply with your state law and regulation. We are not responsible for any misinterpretation of the information related to partial filling of controlled substance C2. Thank you for watching this video.